The Minister of Health and the Department are proposing far-reaching regulations against use of tobacco. They propose, for example, a total prohibition on smoking in what are called public places, which actually means private places like restaurants, hotels, workplaces, offices, and so on. And a ban, for example, on smoking even in open areas where public park or congregate, where people park or congregate, and that smokers will be confined to isolated places like lepers, where they can smoke but may not stay there for longer than it takes to smoke a single cigarette, have to be discouraged by owners from doing so, and cannot be served or enjoy a drink or refreshments or food, and may not simply hang around and socialize. So smokers are to be treated like lepers. This has got nothing to do with protecting non-smokers like myself, but is actually about invading the lifestyle of private people and invading the property rights of property owners and the working relationships of employers and employees, who should be free to agree to their own conditions of relating to each other, and invading the rights of consumers, for example, to go to a place where they can smoke and have a drink or have a meal or whatever, which is currently their right, provided, of course, they don't invade the rights or impose their smoking of and on non-smokers. So this has now gone well beyond the original justification for anti-smoking authoritarian laws, which was to protect non-smokers, and is now become blatantly and shamelessly a violation of the lifestyle freedom and choice of ordinary people. This, we must understand, is not about health now. This is not a health debate, and it's not about a tobacco debate. Just to show how far-reaching the measures are, they propose to restrict or prohibit advertising, for example, of liquor products. And it goes further. There's no stopping the nanny state once it is unleashed, limiting the amount of salt that may be put in food. There's serious talk within the Department of Health about having age restrictions on the sale of junk food or sweets, and making tobacco products, for example, not have branding, so-called plain paper packaging, and compulsory carrying of graphic health warnings, that is, diseased tongues and lungs and so on. And if you take the logic further, then of course we need to put on the sides of cars pictures of mangled bodies, and cars should have health warnings. And we will have, places like McDonald's not allowed to look attractive, and age restrictions on entering. And it goes further, because in communist countries they took this idea of the nanny state regulating our lifestyle and our health to having compulsory exercise every day and basically prohibiting obesity. Now, by far the biggest health risk, according to the Department of Health, is actually unprotected sex, HIV and AIDS. So by their own logic, they should make, for example, unsafe sex illegal. They should ban extramarital sex. They should ban premarital sex. They should certainly ban homosexuality, which is regarded by them as one of the main sources of HIV and AIDS. So the principle is the issue here, the principle of personal freedom. It is argued that the state can invade our personal freedom when it comes to health because the state looks after the sick. So it is said, for example, that the state can regulate tobacco or even prohibit tobacco products simply because people who suffer from tobacco-related diseases go to government hospitals. Well, firstly, let's be clear about this. Tobacco and tobacco products and smokers contribute more in tax than is spent on them. So they are actually subsidizing non-smokers. Secondly, if it is true that they die younger, if there's no exaggeration in the anti-tobacco claims, which itself is debatable, but assuming the anti-tobacco propaganda is correct, then smokers die younger anyway and save us even more because they claim less pensions and less old age and less welfare and so on in later life. The sooner people die, the better it is financially for everyone else. And so these claims are purely phony and in fact dishonest. And then finally we have the minister telling us that smoking has no benefits. Well, this is clearly nonsense. Of course smoking has benefits. I, as a lifelong non-smoker, can detect obvious and conspicuous benefits. The most obvious and the most legitimate, which settles the debate, in my view, in favour of leaving smokers alone, which is satisfaction. They enjoy smoking. That's a massive benefit, and since there is a propensity to call pleasure sin, so we have sin tax on, for example, tobacco and liquor, these are actually not sin taxes at all. They're fun taxes. They're taxes on people enjoying themselves. But beyond that, there are very many benefits that smokers have from smoking. One is the people who have difficulty socializing. It helps them relax. It helps people who have a propensity to drink too much alcohol to drink less. It helps people who are inclined to eat more to be less obese and less eating disorders. It helps people concentrate. It helps people cope with nervousness. It helps relaxation. There are many, many benefits that smoking has. And smokers should be left alone, as should everyone else in their lifestyle choices. What we need is for the nanny state to stop trying to be our nanny, stop telling us how to live our lives, and leave people free. That is subject to one very important qualification. Everyone has the right not to have others being a nuisance or to impose risks on them. This is an old-fashioned thing in common law called nuisance law. So those of us who don't smoke have an absolute right. There's no trade-off between smokers and non-smokers. There's no balance to be reached. It's absolute. Like this, you don't have a balance between the rights of rapists to have sex and the rights of victims not to be raped. It's absolute. You simply may not rape. You don't say rape is permitted on Thursdays or permitted after midnight. There's no balance or trade-off. It's absolute. So it is with smoking. The rights of people who don't want other people's smoke imposed on them should be absolute and uncompromised. That is achieved by, for example, having smoke-free sections in restaurants, hotels, offices, and workplaces. The proposed law will have the bizarre effect of forcing smokers out onto pavements where they will gather, sometimes hundreds of them, outside big workplaces or buildings, such as, for example, the government's own SABC, Broadcasting House, and their non-smokers will be forced to walk amongst and mingle with smokers. So far from protecting non-smokers, this law will be a terrible violation of the rights of non-smokers. Most of all, by forcing smokers out of places like bars and restaurants and clubs, they will be more inclined to socialize at home, which has been the experience in the few countries that have tried these authoritarian laws, where their smoking is imposed on truly helpless victims, namely children, and also, of course, in many cases on domestic workers. So what we need is to get back to the simple principle that people are free to do with their lives as they wish, provided they do not impose on those who want to be left alone and not be have their health imposed on or be subjected to nuisance.